Welcome to our interview series, Southern Perspective on the Coronavirus Pandemic. As we continue to live in global lockdown due to the continuing spread of the COVID-19 pandemic, we also learn about the virus as well as the economic impacts of it is visiting on countries all over the world. We are also getting to understand deeper while it is posing a lot of challenges for us who live here in the UK and in Europe, the hardships in the developing world are more severe. The link, health, and economic crisis seem to be encouraging discussions and unity for the need for radical change. In this collection of interviews, we focus on views from social movements and progressive groups from countries in the global south. They are the ones collectively addressing the pandemic, and more importantly, through this interview, we are sharing how they are imagining and shaping the world anew after the pandemic. The Kerala model is being held up around the world as a success story in addressing the COVID-19 pandemic. This state in the southern tip of the Indian subcontinent enjoys higher literacy rates and stronger public health system than the rest of India. Its community-oriented approach, not just in the current crisis but in previous ones as well, is important to share and learn from. Kerala is a stronghold of the Communist Party, but what makes it unique is the fact that the party is functioning under the conditions of liberal democracy. Today, I am talking to Aswati Rebecca Asok from Kerala. She is an active member of mass movements, notably the Students' Federation of India and Democratic Youth Federation of India, for the last 12 years. She is a researcher in Center for Socio-Economic and Environmental Studies, which is an institute focused on Kerala's development experiences. She is also a member of the Communist Party of India. Hello, Aswati, how are you?
Hi, Dorothy. Fine. And how are you?
Good. Thank you for joining me today. So I will probably start with asking you, can you tell us what is the situation in Kerala and how are the different layers of society differently affected by the coronavirus pandemic? We understand from here that Kerala is one of the areas that was first experienced the pandemic or the COVID-19 virus. So what is the situation there now?
So, currently, I should say that Kerala situation is very much under control. For the last many days, we haven't reported any new cases, and the recovery number of people recovering from the illness is exceeding the number of new cases being reported. So, as of now, in total, 503 cases have been reported in Kerala, and in terms of number of cases reported, Kerala ranks 16th among all the Indian states. The success of Kerala in fighting the COVID becomes evident when we understood that the first COVID case in India was reported in Kerala. That was on January 30th. And one point of time, Kerala was second in terms of the number of reported cases, just behind Maharashtra. But at this point, I can say that still Maharashtra is topping the list. Kerala is 16th in the list with the highest rate of recovery, which is more than 90%, where the national average is nearly 27%, and the lowest rate of death. So, and the number of new cases is being, as I said, number of new cases being reported is coming down gradually. And the number of, right now, merely 30%, 30 number of COVID cases active in our state. So I can proudly say that we have handled the situation very efficiently.
That's actually good, and it's very different from the situation. I mean, generally in India. Can you tell us as well, because I think many are interested to know why is it so? Is it because of the way the government's being run, and also because of the active and politically enlightened citizenry? So how is your state? How come your state is managing the COVID-19 better than the rest of India?
So if you ask me for a one-line answer for this question, I will say that it was achieved by a teamwork of a determined leadership which believes in an ideology that places human beings before everything. So as you said in the introduction, where the European countries and other well-developed liberal democracies failed, because they were we have seen the responses of different world leaders like Trump, Bolsonaro. They were saying it's a very minute virus, it's not a death it's not a deadly virus. We should give prominence to economy. So, but from the initial moment itself, Kerala, like I think by mid-January, the outbreak of corona in China became obvious. From that moment onwards, Kerala was trying to face the contingency, the crisis. The interstate machinery mechanism was functioning efficiently. Till the, like, you must be knowing about the decentralization efforts of Kerala. So we have a very active local government bodies at the grassroots level. So in every layers of government, mechanism was functioning very efficiently with the support of, and I should say about the, like, mention about the rich public action. This public action is one thing which makes Kerala model always unique. Be it in the case of land reforms, earlier land reforms, this, as I said, the decentralization and the literacy movement. So the participation of mass is something which makes Kerala development experiences unique. And we have the only state in India which is having a institutionalized system of voluntary workers. We have around 30 lakhs number youth is participating in voluntary work, which is actually institutionalized by the government. And for the last 2 years, these people has been given the training to face a crisis-like situation. Batch-based training has been given. So when this came, actually, we were very well prepared. And the robust, I should mention about the robust public healthcare system. So it is this is not something which came up this time or like for the last 2-3 years, but it was a progress, like ever since the first communist ministry in Kerala was set up in 1957. The attention given to the social sectors like health and education was crucial even this time in dealing this crisis. We have a very well-equipped public health system with different layers. In one layer, we have doctors, nurses, and other medical staff. And at the grassroots level, we have the, uh, we call them ASHA workers, community health workers, basically, who goes to house, asking about the nutrition of children and the pregnant ladies, who take care of the health effects of the elderly. So in that sense, we have a layered system of public health system which is functioning very efficiently. And the vigilance, and this time the effective vigilance shown by the government. And also, I should say this: the fight against this COVID of Kerala should be different, to be classified into two, basically, broadly. One is the health aspect, as I said, about the public health system and the vigilance and this monitoring, testing, all sort of things. The second part is the socio-economic relief packages to enable the people to deal with the adverse effects of the lockdown. As we all know, the lockdown hasn't spurred any section, but everyone was actually adversely affected by the this standstill of the economy, especially the migrant workers, daily wage laborers. So for each and every minute things, the government has been giving like minute importance to each and everything. Every day, regularly, the Chief Minister of Kerala is holding a media press meet. So that is one through which he actually summarized the situation of the COVID situation in Kerala state and the measures being taken to deal with the situation. So that's a kind of confidence boosting for all of us. It's currently that program is the most widely seen and most awaited program in the state. So that kind of transparency was there. Yeah.
So it seems like a really good combination of voluntarism and high organizational level and a very strong collective spirit. I wanted to follow up when you mentioned the health system, because normally people would think that in a state like Kerala, the health system would be public. But in reality, it's actually highly privatized. So that means there's a very healthy combination or coordination between the public and the private. Can you tell us more about that? How is that?
Yeah, but I should say that the public health is the most prominent aspect in health system of Kerala. Private is there, which always cooperate with government efforts. But the primary focus, like especially the left government, use for the expansion of public health facilities. You know, this government came into power in 2016. So from that time onwards, a huge program has been initiated to develop and expand the public health system of the state. So currently, around 4,000 crore rupees has already spent to develop the expand the public health system. And we have a new scheme has been initiated, which is called Ardram Mission. So through which all the public health, like we have a primary health centers and above the district facilities, and so it's a layered system of public health. And through this scheme, the government is trying to modernize the entire public health mechanism and to develop, and especially to give importance to the community medicine kind of thing. So earlier, like 2 years before, we had another outbreak. You might be knowing about Nipah virus outbreak, which affected Kerala badly. But at that time also, we were able to contain it efficiently. We developed a strict protocol, a health protocol, which still a mechanism, an efficient mechanism from the state level, district level, and to the local body level. And we are able to follow that. But all these efforts, private hospitals are also cooperating with the government. That's a good part.
Yeah. Well, if you will give us a view from Kerala of the rest of India, you have mentioned earlier that the different states are approaching it differently.
Yes.
So yes. How do you think, how will the Indian government withstand the crisis? What should they do, and what will happen?
Yeah, very much disappointingly, I should say that the lackadaisical approach they shown to this crisis in the initial period was very much problematic. You know, as I said, like the first meeting regarding this issue in Kerala was convened on January 18th. From that moment onwards, Kerala was preparing to face any kind of situation. But the initial response of the central government was like, it's not a deadly virus, the mortality rate is quite low, so we don't need to worry about much. And you know, on 27th February, where then this novel coronavirus has been declared as a global, declared as a global pandemic by the WHO. Even after that, the Prime Minister of our country, Narendra Modi, has conducted a massive rally in his own state, Gujarat, along with Trump, the US president. So almost more than 1 lakh people participated in that rally in the midst of a crisis where we were advocating the need of a physical distancing. So that was the kind of approach they actually followed. And then by mid of March, they recognized the situation, like the gravity of the situation. Then what they did is on 23rd of March, they suddenly announced the lockdown in the country without taking any kind of preparedness, without giving the people to do the basic facilitating them to do basic preparations to deal with the situation. So all of a sudden, lockdown has been declared, and we also how the migrant laborers from different states, the migrant laborers in cities, started on foot because there was no transportation. So there was like walking kilometers and kilometers to reach their native villages because they were sure that they cannot get a accommodation or food if they remain back in the cities. So that was the kind of approach they shown. But instead in Kerala, it was a very gradual process. From March 10th onwards, we were preparing for this lockdown thing. From 10th on 10th, all the schools and the massive the film theaters, everything got closed down, and we all were buying things, stocking up things. We are gradually actually moving. So, and by the time the lockdown was declared, we didn't have much problem. And the government, and even before the lockdown, the government of Kerala announced a massive relief package of 20,000 crore rupees to enable the people for the direct cash transfer in the hands of the people. And one important thing I need to mention here, that the way Kerala addressed the issues of migrant laborers. So how we took care of them is, I think that should be replicable. Because as I said in the press meets of CM, he repeatedly referred them as guest laborers, not as migrant laborers, guest workers.
Mhm.
So that kind of thing instilled in even in our mind when like so everyone in the society was trying to, and he repeatedly asked the Kerala society to take a good care of them.
Mhm.
So everyone was actually they were the community kitchens were set up for to provide food for them free of cost. So it was like I should say it was an unprecedented kind of
Yeah.
the handling of situation.
That
Yeah,
that sounds brilliant. Here, when you say unprecedented, it is
yeah,
used as an excuse for
yeah,
failure. You know that we can't
yeah,
do things because it's unprecedented. So, in terms of national level or both state level and national level
Hmm.
organizing, are there how is the collective
Yeah.
mobilizations with a change situation? We can't organize. People could not hold mass
Hmm.
gatherings.
Yes.
How are people adjusting to that?
It's actually quite difficult, I guess, because Indian society is a very much socialized system, and all of a sudden you cannot meet people. Like announcing that you cannot meet people, you cannot go out, you cannot hold protests. So you should like it was quite difficult for them, but yeah, in Kerala, I should say people actually managed to do well, and even as you said, the collective that effort was there. Like even if we are sitting at home, we were doing all sorts of work in our own way. We are helping each other. That the slogan of Kerala is physical distancing with along with the social unity. That was a slogan coined by Kerala regarding the situation. Yeah, but in other parts of the country, but I don't like as I said, the situation was quite grave in other parts of the country. So people, yeah, because they don't have any money with them, they don't have any means to sustain. So people actually they were going out, they were not strictly following this lockdown or physical distancing. And obviously, a country with its majority of its population below poverty line, asking them to keep physical distancing without providing any relief, it was quite difficult. So people were actually going out in search of job, food, because the kind of relief package announced by the central government, that was like merely 1% of the GDP. You
Mhm.
know, in this situation, uh, they were not even ready to provide some cash in the hands of the people. So it was a situation. But I should say the left organization, especially in the like the trade union movements, the student wings, youth wings. So in their country, they were actually doing a good work to provide uh, food and other essentials to the people. So they were basically running the community kitchens, distributing food materials and other essentials to people through a voluntary work and all. Yeah, they were helping out.
Are there efforts to link all these initiatives national level in the absence of the possibilities to hold national level campaigns? Or are there efforts also to build like a national agenda or national call for what India will be after this pandemic, and especially given the situation and the level of democracy in the country now? So what are those demands? What are those initiatives? Other alliances being built and those kinds of efforts.
As of now, the primary focus is given for the like containment of the situation and to overcome the situation. So I think all the parties, all the political parties, all the organizations are basically concentrating on this effort. But one demand which came up from basically from all the oppositions unanimously is for the much more effective announcement of much more effective relief package, because you know all the other countries like they have, even including USA, they have announced a 10% relief package of which amounts to 10% of their GDP, and where India announced a relief package which comes around only 1%. So right now the major campaign is running around is to increase the cash flow into the economy, and obviously, and the states are facing a huge fiscal crisis currently, because the center has imposed a limit onto the borrowing capacity of the state. So, and they are not actually distributing the money we are entitled as part of the goods and service taxes. So that kind of, in one way, all the states are under financial crunch, and there's a limit which state can do, and state has to bear all the major expenses to be this situation. So there's a concerted demand from all the states and the opposition parties to increase the borrowing limit and increase the financial distribution towards state, and to introduce some more huge relief packages. Yeah.
Yeah. Maybe at this point, I also wanted to ask you, what are the initiatives in terms of building solidarity internationally, and what will be your message for us here in Europe, for us here in the UK? So how can we build linkages and connection between us here in the UK and in Kerala?
Yeah, one good thing I like, which I think which came out of all the situation, is that we are actually thinking of the need of a term socialization of everything. Like maybe uh, in UK it's much better, but in other developed capitalist countries, still this time the approach was even the health is a private affair, not a social affair. But this pandemic proved to us that health is not a private affair, but it has a huge social aspect. So in that sense, there should be an international solidarity is essential, because in this globalized world, uh, a small virus which started, like if it's supposed to be started, we don't know the exact sources, but it is told to be started from the Chinese market, has spread to the entire world, and we are actually running behind a small virus to defeat it. We are actually fighting. The entire economy came to a standstill for 2 months to 3 months. So in this globalized world, without an international solidarity, we cannot, uh, because it's not a human created thing or something, it's a natural calamity. How to meet a natural calamity, be whether it's a pandemic or it's a climatic issues, climatic changes, it needs our international solidarity, which we have to develop with the developed global right, global left, global south, global north. We have to combine. And we like very disappointingly, I should say, the way Trump has mentioned about the WHO thing, World Health Organization efforts. So at this point of time, no one was expecting such a statement from a person who claimed to be the leader of the country, the world. So that's such kind of responsible people. The leaders should be kept them apart from such kind of statements. But we need to build the national solidarity. We need to think of a alternative model, which I should say should be a socialist kind of model. Yeah.
Okay. Swati, Asok, thank you very much. And I
Yeah.
wish you success in all your initiatives there. Thank
Yeah.
you.
Yeah. Thanks a lot, Dorothy.